Snoring, a very big epidemic these days. So let us see what it is about. Hi, this is Dr. Priyanka, consultant ENT and head and neck surgeon, KIMS Kondapur. Why is the snoring gaining a lot of importance these days? Previously, when somebody used to snore or the people beside used to just make fun about it. Hey, he snores a lot. Nighttime I hear a lot of different kinds of sounds and everything. It was fun that time. But now, in this era, why are we actually concentrating more on it? Because of our lifestyle, the sedentary jobs that we are having and the kind of food we are eating plays a major role these days. Why are so many people having hypertension and diabetes very early? These are a few things that we need to observe and notice. Mainly, when you're snoring in the night time, that means you're not having a proper sleep. Firstly, this leads to daytime sleepiness and lack of freshness getting up early in the morning. What happens when you snore in the night time? You tend to open your mouth, take air through your mouth, which is not the right path for the air to reach your lungs. What does the nose do? It usually filters the air, conditions it, and sends the proper right kind of air our lung needs. When this process is terminated, that is, the path is moved and the air is taken through your mouth, it goes into the lungs unfiltered, causing a lot of lung issues. And when you're snoring in the night time, your heart is working overtime where it has to relax, rest, and make you ready for the next day. So because of this overworking of the heart, there are a lot of heart issues coming up, early hypertension, and in a few cases, diabetes and other immunological issues are raising up. And the other important part is your partner. When your partner is not able to sleep because of your snoring, and it might be affecting their lifestyle also. So there is a protocol that we follow to first diagnose your snoring and see in what levels do you have the obstruction. So in this, first we go for a sleep study, that is the polysomnography. What does this show us? Polysomnography shows us how many times you are waking up in the night time and how much your oxygen level is falling, and is it a central kind of an apnea or obstructive kind of an apnea. This is the first step where we try to know how your sleep patterns are. So once we get this, once we get your AHI values, once we get your lowest oxygen saturation, then we move on to the next step, examination by a doctor. So when we have a clinical examination, we see your nose, your oral cavity, and complete ENT examination. If we find any nose deviations, that is your septal deviations, or any polypoidal tissues in your nose, that is one marker. Coming to your oral cavity, how is your small tongue, that is also called as an uvula, how are your tonsils and your lateral walls on a direct examination. Then we suggest you to go for a small scan, which is a CT paranasal sinuses, which tells us the pattern of your nose, your sinuses, and the nasopharyngeal area. Once this is done, this is the most important point where we go for a drug-induced sleep endoscopy called DICE. Then we introduce an endoscope through your nose and pass it down till your vocal cord area, which is the larynx. Below the vocal cords, we have the trachea, which has a strong rings, so the collapse doesn't happen there. So right starting from your nose till your vocal cord area, this is all the collapsible place which might cause your snoring. So it is a multi-level thing which is leading to your snoring. So the nose, the nasopharyngeal area, then your small tongue, soft palate, the tonsils, the lateral walls, then comes your base of the tongue, the epiglottis. So this is a multi-layered phenomenon. So once in DICE we get to know where your obstructions are, then we come to decide on the proper diagnosis of your snoring. Then we suggest you what kind of a snoring surgery we have to go to. Many people have a doubt, is the surgery only solution? No, may not be. It depends on the kind of obstruction you're having. If I take two age group people, who's a middle-aged adult and an elderly aged adult, I get a patient around 65 to 70 years with a lot of comorbidities and they're not ready to go for any surgery for their snoring. We have another option called CPAP. Whereas I cannot ask a middle aged young patient who is very socially active to go for a CPAP machine to stop their snoring, because you have a lot of social things, you move across, you have a lot of trips to go. So, then what to do? Let us get it diagnosed and then we can go for multiple snoring surgeries. Depending on the levels of obstruction, we can have single stage surgeries and two stage surgeries. So, all this we'll explain to you once we properly diagnose you with snoring. Please do not neglect it, as it is now becoming a very big epidemic. So, please get to us any kind of a snoring issue from you or your partner or somebody you know. We are here to help you, guide you, and tell you what exactly can be done and give you a peaceful sleep. Thank you.